Hey there, welcome back to Adam Rambles. Today we're going to talk about the most important thing that your doctor can give you and the most important thing that you can do for your own health. A little bit of health care, or not even health, other areas too. The most important thing you can do to improve on any area of life. So, what is the most important thing that a doctor can give you? It's a proper diagnosis. Now you might be thinking medication, or even if you're like needing life-saving care, he's got to diagnose or she's got to diagnose appropriately in order to give you any sort of appropriate life-saving care. If the doctor misdiagnoses, then they're treating the wrong thing. And if you can't get a proper diagnosis, then you can't get the proper treatment. And I've seen it where people have been misdiagnosed, and I've also seen it where they just are not given a clear diagnosis, and sometimes that's because they don't have enough information. Often it's because it's what we call subclinical. Now, subclinical, what does that mean? I'm going to use diabetes as an example. But as an aside, I made some chili this week and it was pretty good, but I had some expired cans of beans and I used them anyway. And then as I was using them, I was thinking, what is the likelihood I just die of botulism? For those too young to know, it used to be a big thing. People would can on their own, and they wouldn't use good practices in their canning, so they would get a little bit of this bacteria that would grow inside the can. And the bacteria grows really well in the absence of oxygen. And so the bacteria would grow over the years, the can would swell, people would eat it. And then inside your body, there's not very much oxygen in your digestive system, which is pretty fascinating discussion in and of itself. They think that there may have been, this is why I'm going down this road with you. Scientists think that the bacteria that was on Earth before mammals and such lived in an environment where there wasn't very much oxygen. It thrived in that environment, and as the oxygen levels increased, new organisms began to grow, and those organisms actually began growing inside of us in an environment that mimicked the environment that there used to be on Earth, which was a low oxygen environment. Anyway, all that aside, for whatever reason, this botulism toxin will grow inside your body, and within like a couple days to a couple weeks, it'll get to the point where it'll start shutting down systems. It can be a big issue with babies, where the toxin will actually be in the womb, and the baby will get exposed to it. But there's only like 1 to 200 deaths a year. It's not even deaths, 1 to 200 cases of it in the United States anymore, because the cleanliness practices and the canning practices are so good. So hopefully I don't die of botulism because I ate that chili anyway. Anyway, and then a few years ago, I got scraped on this piece of rusty metal. And I was like, do I have to go into the doctor? This is a small cut, but it was substantial. And I'm thinking, I don't want to die of tetanus. For those of you who don't know what tetanus is, people used to say, oh, you're going to step on a rusty nail and get tetanus. But, I guess we used to just be really crappy about cleaning up stuff back in the day, because I don't see very many rusty nails around anymore. I don't see very many nails around anymore. I don't see very many rusty nails at all. So nails, they put better coatings on them, and they don't rust as quickly, so you rarely see a rusty nail anyway. But you rarely see a nail anymore. I guess people were just walking around construction sites or whatever. People were hammering stuff, and they used to just throw their nails. And, whenever that happened, you would get this rust on the nail, and then you can step on the nail, that rust gets inside of you, and the bacteria on that rust can cause a condition called lockjaw or tetanus, where your jaw just clenched shut, and your muscles go into tetanus where they contract. It's essentially a cramp. Like, picture the biggest cramp you've ever had or seen, and your whole body can just shut down and you can die. So I'm like, well, gosh, I don't want to get tetanus. What's the likelihood that I get tetanus? Extremely low. It's like less than 100 cases per year, and almost all of them are diabetic, which leads me to the third thing I'm going to talk about, which is diabetes. Now, diabetes, it's like 85 million, something like that. The numbers, I can't remember exactly off the top of my head, but it's a huge percentage of the population. I want to say it's like 18% of Americans have been diagnosed with diabetes, to the point that people just don't even think that it's a big deal anymore. Like, I'll have patients that are like, oh, hey, I'm good. I've only got 129. If I have 130, I'm going to need some medication, but I'm just at 129, so I'm all good. Should be at like 95. Now, for people who don't know, diabetes, it's a huge deal. It's a huge problem. It's a big deal. But here's the thing. You can be subclinical. We have to make a line, like, when does somebody have diabetes, when does somebody not? We've got to draw a line somewhere. And so if you're 1 point below that line, the doctor might give you a little bit of counseling on your lifestyle or something, but they're not even going to diagnose you. Nowadays, they might give you pre-diabetes or something, but sometimes decades before you're even diagnosable with pre-diabetes, you could be diagnosable with hyperinsulinemia. So in order for you to have diabetes, I know I'm going down this road, but you've got to have your blood sugar reach a certain level. But in order to have your blood sugar reach a certain level, you've got to have your insulin not be working in your body to the point that your insulin levels rise to try to take care of the extra sugar. And for a while that works until your body becomes resistant to the insulin. So your insulin levels go up, then your body becomes resistant to those insulin levels, and then your blood sugar goes up. And so even before you're pre-diabetic, you're really like pre-diabetic, and you could do something about it if the doctors would actually measure your insulin levels instead of just your blood sugar levels. So maybe get that checked next time you're at the doctor, but it's neither here nor there. The point is, if they don't properly diagnose you, then they can't properly treat you. And then the next step is, now you know that you have this diagnosis. What is the actual best way to deal with it, with fixing the problem? I have a family member who's a nurse practitioner, essentially like a family care doctor, and he says on the regular, his job as a Western trained medicine provider is to make you more comfortable in your diseased state. And I think that's the perfect definition of modern medicine, like medicine 2.0, you might call it, or 1.0. Like, we're not going to the witch doctor anymore. We're looking for scientific things that might be wrong or right. And that leads us to a diagnosis. It actually helps us do really well with acute medicine. You come in with a broken leg, we can scan it, we can fix it. You come in with a heart attack, we can diagnose that, we can fix that. But you come in with high insulin levels, and we're not so good at that. We will make you comfortable in your disease state. We want to actually fix your disease state. We give you more insulin. Well, that's great. Your body's already not paying attention to the insulin, the high levels of insulin that you've got. So now we're just going to make your insulin levels higher. Yeah, well, it brings down your blood sugar levels, but it doesn't fix the problem. So the number one thing that a doctor can give you, or, let's say you have another problem, financial or something, like a financial advisor, or a relationship problem, or a mental health problem, or a job problem, or whatever it may be, the number one thing that a professional can give you is the proper diagnosis. Now, once you have that, you might be able to go find if the person that gave you that diagnosis isn't the right person to give you the treatment for that. Don't put a Band-Aid on it, so to speak. Like, don't give yourself insulin. You want to actually make your body more responsive to insulin and eliminate the problem. And so proper diagnosis, number one, once you reach that proper diagnosis, what is the most direct route to actually fixing the problem? Should be your next question. And it, if you go into the doctor, that's what I would ask. You get doctors, let's take osteoporosis, your bones are brittle. The doctor's going to put you on a medication that probably isn't going to help you eliminate the osteoporosis. It's going to help you have a lesser chance of having a fracture. So again, we're symptom management. We're making you more comfortable in your disease state. In case you're wondering, there are things you can do about both osteoporosis and diabetes and a number of other things that may be going wrong in your life. But get the diagnosis first, and then seek out someone who knows how to treat the root cause of those problems. As a physical therapist, I'm often a person that can fit that bill for people. If they have dizziness problems, we can get to the root of those most dizziness problems. If they have balance problems, if they have pain problems, we can often get to the root cause. But often it's like 6 levels deeper, and it's like a whole big lifestyle issue. Like nutrition is off, sleep is off, stress is off. So get diagnosed, get the right professional to help you, or the right program or the right plan, and then take the first step towards actually fixing the problem. And then the next step, and then the next step, and then the next step. You work your way down the line. But there's going to be a most direct path, and you should take it in whatever it is that you're not doing. Now, it always drives me bonkers when people actually have already gotten a diagnosis, or in some case self-diagnosed, whatever it may be, whether that's a medicine problem or like a relationship problem, and you've diagnosed that issue. I'll give you an example from my life where it drives me nuts. I'm really terrible at going to bed on time. And so my symptoms are, I'm tired. What's the solution? It's not sleeping pills or medications or whatever. It's the solution is going to bed on time. The solution is not medicine. The solution is not caffeine. The solution is sleep. And I should properly diagnose that. And then I should take the most direct route to fixing that permanently. Because caffeine is going to be a short-term fix and a long-term problem. And sleeping pills is probably not even going to be a fix for that problem. But, if I had a sleeping problem that it was getting to sleep, maybe melatonin, that'll get you to sleep like 9 minutes faster. Maybe that's a thing, but there's going to be something that's disrupting the sleep. Anyway, you get the idea. Whatever it is, you got to dig a little deeper to get there. And then you've got to take positive action to fix those problems. So get about it. You know there's something wrong somewhere in your life. Get it diagnosed if you don't already have a diagnosis. If you do have a diagnosis, seek out the right proper treatment, so to speak, or plan or course or whatever it is. If it's financial, you're seeking out good financial advice. And this goes a little bit to what I talked about in the last video. Look at where that road is leading you, and is that a place that you want to go? So let's go back to diabetes. You have diabetes, you go to the doctor says, oh yeah, we specialize in this, we have thousands of patients with diabetes. What are their outcomes? That's the next question. For the last 10 patients that you've had that have had my state, my set of symptoms, what are the outcomes of those patients that were sitting in this chair 10 years ago or 5 years ago? Do they still have these problems? What are those outcomes? If the outcomes are, well, they're doing okay, they're still, working their way, leave. Like, go find someone else. The outcomes need to be, this is fixed. This is done in my life. And that's going to take the right professional and the right action from you. Can't expect them to do all the work. It's you doing all the work, them telling you what work needs to get done. So get about it. Anyway, direct. So diagnose, proper plan, follow the plan. That's all there is to it. Fix pretty much any problem in your life with those 3 steps. But if you're not getting the right diagnosis, keep seeking. If you're not getting the right plan, keep seeking. And if you're not following the plan, make a mental change, follow that plan. Maybe that's the thing you need to diagnose. Maybe there's some depression, maybe there's some mental blocks, maybe you need to be seeking that first. But gotta get to the root of it. You gotta get to the root of it. Anyway, I feel like today was a lecture. So get out there, solve those problems, get it done. I'll see you next time on Adam Rambles. Thanks for being here. Share in the comments what you think and what problems you're going to be fixing and what things you're going to need to get diagnosed and what steps you're going to take. Share it in the comments. We'll catch you next time.